All right. Hey guys, Dr. Dent here. Thanks for tuning in. Doc Spine and Sports Medicine podcast is going to video. Who knew? So today we're going to be covering just a couple common reasons for back pain, how to correct it, and the big why, right? So first we're going to cover some of the structure and function of the spine. Pretty basic stuff here. This is called the vertebrae. This is the disc, okay? And on this vertebrae, this is a healthy one, you've got a spinous process, transverse process on each one of these. Now, every lump and bump on any bone, there's gonna be a muscle attachment to it. So, right here, you got what's called an interspinous muscle, right? You got over here called intertransverse, right? And these are all called rotors, okay? Now, this is all there specifically so it can measure any kind of tension that's in the spine and make sure everything's going right. These muscles do nothing but measure stretch, right? Just to make sure everything's going the right way, because if it gets to be too much, it'll send a signal to the big paraspinal muscles that run from the base of your skull all the way down to the top of your rear end. If anything goes wrong, it's going to throw all those into spasm and cause a big problem, right? So it's going to cause back pain. Most people have had it in their lives. Now, what's important again is this is the disc, okay? Now, on the outside of this thing, it's called the annulus fibrosus. The inside stuff is called the nucleus pulposus. The nucleus pulposus is about 90% water. It doesn't compress very well. Does a very good job of allowing some kind of cushioning, just like Asics gel runners, right? Really good stuff. But the vascularity, any kind of artery, vein, what have you, all dries up. So it gets no nutrient through blood flow past the age of 18. So the only way it gets fed is through axial loading and then unloading. It's called imbibition. Just like when you wash dishes and if you were to take a glass and pull it upside down, all that water is going to go into it, right? It's just through negative pressure. Same principle here, okay? So that's problematic because as you get older, things kind of change on you. Now, the number one reason people get any kind of disc issue is not because they did something wrong. Most of my patients come in and they have just a terrible story. You know, like, oh man, I just was laying down to get paper, or toilet paper, or just litter, anything, right? Nothing crazy. I don't have heroic tales of somebody stopping a school bus or anything like that. It's always just something ridiculous. Now, here's what's interesting. This stuff on the outside, this annulus fibrosus, okay, that is actually stronger than bone. If you were to land on your rear end, you'd think that it would explode outward, right? If you jumped off a roof and had an impact, you'd think it would go outward. It doesn't. It actually goes into the spine. It'll break bone. It's what will cause like a Schmorl's node, right? So this stuff is really tough, but overall, over time, it's going to cause, it'll become desiccated, get dried out. So you end up with something that looks like this. Now this is bad. Now, typically you'll have an old injury here, right? Now, everybody's had some kind of back issue where they've been in a car accident or something, right? So now all these muscles are freaking out because they know something's wrong. So they signal out to the back strap, hey, lock down. I don't know what's going on, but I know that I don't want it to get any worse, okay? So over time, you figure out a new way to move. So the pain gets suppressed and you're doing okay. But here's the problem. This is never ever gonna go away unless it gets corrected. So you'll always have that, man, my back still hurts from that time when I was 30 or 20. It shouldn't be that way. This needs to be corrected. Because now that back strap, that paraspinal muscle is never gonna release. So now this isn't getting fed the nutrients that it needs. So over time, and this can be as short a period of like 5 years to where you're surgical, and you want to avoid that. So this right here is a damaged disc, and it's a bulge. That's fine. A disc bulge, most of the population has that. They can mitigate circumstances. You know, you can do a lot of stretching exercises like upward facing dogs, stuff like that, but you're heading towards what's called an HNP, a herniated nucleus pulposus. Now, one of the things I didn't mention is that the nucleus pulposus hasn't been seen by the rest of your body since you were formed in the womb. So when it does come out into the rest of the body, there's an autoimmune component to this. So you really want to avoid that, because as soon as it comes out, it starts attaching itself to the nerve right at the central nervous system. So it's going to lock down at that area, and you're going to have inflammation. You're going to have a whole lot of problems with it. So if there's an HNP, you're surgical. If you don't get surgery within the first 6 months, it's you're looking at getting, let's say, the difference between sucking a pimento out of an olive versus getting gum out of hair. So if you have an HNP, get surgery quickly. If you don't, get it taken care of. Go see a chiropractor, a PT, somebody. Because what's going to end up happening is a chiropractor, or sometimes a PT, depending on your state, may be able to put this back in place to where it'll take pressure off of there, break spasm on that muscle, rehydrate the disc, and let the body heal itself. That's all we're doing. Ultimately, pain's what drives this, but stay ahead of it. Anyway, that's my time. And please, if you have any questions, please shoot me an email, reach out to me on Facebook, Messenger, whatever. Let me know what you think. And if you find a chiropractor that can cure all this, please let me know. God bless.